So one of the things for me, as somebody who's always labelled himself a harm reductionist for more than 20 years now, is how to reconcile harm reduction with the recovery agenda, which is now at the core of our drug strategy and every contract for services within the drug sector, and this sort of polarisation that is almost excessively discussed, in my opinion, but but still preoccupies people, as though there is some distinction between harm reduction and recovery and some tension between them, which personally I just don't see and never have. Right from when the ACMD published a hierarchy of harms where being drug free was there amongst them as something that is one way of being that would reduce harm or will minimise harm, but nevertheless the people are preoccupied about how the recovery agenda and the harm reduction agenda come together, or whether they're in conflict. And I think for me the terms really are unhelpful, because if we think about fundamentally what is behind recovery when we look at some of the definitions that come out of the United States and that are discussed within the UK Recovery Federation principles, fundamentally what we're talking about is human development. And similarly within harm reduction, where we have a concept of a hierarchy of harms, about reducing those, about sort of enabling people to develop in ways where the focus is on the harm, but it's about sort of minimising that, which is sort of inverse form of development. The less harms you've got going on, the better developed you are, in a sense. And a person who has greatly influenced my thinking, who I'm glad to have seen coming over to the UK in the last 12 months, is a guy called Jakob Huber. So in German-speaking countries, they broadly talk about acceptance-based services, which we would term harm reduction services, and abstinence-based services. And Jakob is a man of rare wisdom and vision, I think, because he, before anybody else that I can think of, said to people, this is crazy, we're not different things, we're all part of the same thing. And the unifying notion, and I had to write it down into my phone about 3 times before I got it right, is Envisioning, which is a very long and complicated German word for a monoglot English bloke like me, but Envisioning means development oriented. And as soon as he said development oriented, I suddenly recognised that for me this is the unifying aspect of harm reduction and what the many things that comprise recovery, because recovery is discussed in our strategy documents and by people who are doing the steps and who are working in services in a way that has a whole range of understandings, some of which I find very oppressive and very unhelpful, because they impose a goal on people that the people don't necessarily value or recognise or strive to. So if you say whatever you're using, you have to stop using it, well, that doesn't necessarily help people very much if they're just wanting to use less, or they're wanting not to use crack but they want to still smoke cannabis or want to use heroin at weekends. Whether that's realistic or not, it is for some people, it's not for others. But as soon as he introduced that term, and I saw development as the sort of unifying concept that he had to fight for a number of years within his services to get his staff to recognise as the unifying principle, that then gave me the idea that allowed me to think, okay, this is how we have to work to reconcile harm reduction and recovery in the UK. And it all joins up because You know, everybody, whether you're using drugs or not using drugs, whether you're smoking crack and banging out heroin every day, or whether you're a teetotaler, every human, I think, fundamentally needs to develop. You know, this is just the most fundamental of values about being a human. And so you can really in some respects, take the drugs out of the equation entirely and say we're all about development services, because of course drugs are often the thing, the name, the label that allows people to walk through the door because it's got a drug service in its title. But people have got family history, abuse, disturbance, economic woes, unfortunate things that happen randomly to them in life, bereavement, all sorts of things that are difficult for them, and that sometimes come together and contribute to the use of drugs becoming problematic for people in a way that spirals out of control and means that the drugs become seen as more of a problem than part of the solution, which very often it starts off as being, you know, people using drugs because it actually enables them to socialize with people or to suppress stuff that is crushing them, and you know, that is really painful to think about and to experience. And so if we understand ourselves all as being about development, then really I think it makes the terms harm reduction and recovery redundant in a way. And I'd prefer us all to be focused really primarily on this notion of development, and to move past these terms and to understand giving out clean needles and giving out naloxone and providing opioid substitution treatment and providing drug-free day programs for those people who want them, and providing education sessions in prisons and training and opportunities for employment, all as part of the constellation of things that we collectively provide and jointly for people, that will enable people at the very many different stages of a drug-using career, to use a term that's quite widely used as people move along through different phases of their engagement with using drugs. And whatever you're doing, whatever realm you're working in, you should be thinking about people's development. So you should be, with somebody who is injecting, thinking about enabling them to inject more safely. Give them the physical means to do so, ensure that they've got enough needles and syringes for them and for their peers who may not come anywhere near your needle exchange because the risks of doing so are too high, because perhaps they have children or they've got jobs or whatever it might be, that means that actually on balance coming in through your door is more of a risk than staying away. So yes, of course, get needles and syringes out there, but also grab every opportunity where people are telling you that actually there are other changes that they want to make, where there are other things going on for them that are problematic in their lives that you can help address, whether that be domestic violence or debt problems or housing problems, the fact that you went to a shit school and you came out with no qualifications and you're barely literate. All of these things together, I think, are really what services should be about. And some of the important gaps, I think now, are the sort of causes of some of the tensions within the field, because we've been immensely impressive at getting clean needles and syringes out to people in a way that has meant that we have among the lowest rates of HIV among people who inject drugs in the world. You know, this is a fantastic triumph that people just sort of fail to recognise so much of the time. But yeah, you could be in a country where you've got a 40 or 60% HIV prevalence rate. That's a very, very big problem to have in your population. We don't have that. And we have lots of people who now have access to opioid substitution treatment, OST, who, because of that, don't have to go out on the game shoplifting, who can have some order in their lives that allows them to be more effective parents, to spend more time with their kids, or as carers for their elderly parents, or with their lovers, just enjoying life in the way that everyone wishes to enjoy their lives. But what we've been less good at, and I think this is where some of the critique of the harm reduction comes from, is providing some of the things that then have to complement and build on that. And I think there's a legitimate criticism of our system, which says, yeah, we've got so far so good, we've done some basic stuff there that means that some of the basic harms no longer occur and some people are able to make some progress. But the stuff that then allows them to fulfill their ambitions, for those people that come in saying, I want to be drug-free, or I want to be somebody who works with animals, or as do something connected with history or archaeology or sport or something. We've been very poor at connecting people into those sorts of things. And so, the encouraging signs that social enterprises are increasingly seen as a vital complementary part of the services that are provided is, I think, really very much to be welcomed. And it's really vital that everyone, whether you're working in a frontline needle exchange or whatever your role is, you are thinking about, okay, beyond doing this and doing this to the best possible standard, how else can I be supporting the people that come through the door to achieve the things they want to achieve?